Priscilla and Connie, I have sent the request for both of you to be able to unmute yourself. And again, welcome everybody to today's presentation, the prior program year 2021 Objective 1, Protective Patient Health Information, the Security Risk Analysis, and Objective 8, Public Health and Clinical Data Registry Reporting. The open forum is supported by Health Current. And oh, great, it looks like we got some more questions or some more folks joining to be able to answer. Again, if you're just joining us, we are going to be using polling, and we encourage you to text the word EO program 753 to the number 22333. Or if you're using your desktop, you can go to pollev.com and enter the word EO program 753. And that will get you ready to engage in today's presentation virtually. We do have a lot of folks who are joining today, so we are going to be muting all lines. We encourage you to use the chat feature within WebEx and ask your questions throughout today's presentation. This presentation is provided through a shared commitment between Access, Health Current, and Myers and Stouffer to increase participation in the Medicaid Promoting Interoperability Program. We are recording today's presentation, and we will send it out along with a PowerPoint slide deck and any of the other documents that we share with you today. Connie, are you with us?
I am, Christine.
Wonderful.
Thank you. I have the great honor today to be able to introduce to you Priscilla Clark as a senior accountant with Myers and Stouffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, is our webinar presenter today. She is extremely talented and very, very knowledgeable, so consider yourself lucky that you get to hear her today. Go ahead, Priscilla.
Thank you, Connie and Christine. So as already been identified to y'all, today's presentation will be an open forum, so feel free to ask any questions throughout the presentation. Put them in the chat box, and at the end of the presentation, you'll definitely be able to unmute yourself and be able to ask any questions that you may have currently about any of the objectives or requirements for the Meaningful Use Program. Today's webinar will be focusing on the security risk analysis and Objective 8, Public Health and Clinical Data Registry Reporting. But again, keep in mind that you can ask any questions about any of the requirements throughout this presentation. Next slide. So this slide is just explaining the changes that occurred between program year 2020 and program year 2021. As you're probably all aware, both programs require providers to attest to stage 3. So there's not that many changes. However, when it comes to the reporting periods for each year, that did change slightly. As you can see, for the PI 90-day reporting period, the 90-day reporting period in program year 2020 must have started and ended between January 1st and December 31st, 2020. However, you can see that there's a slight change in 2021. So for program year 2021, that 90-day reporting period must start and end between January 1st and October 31st, 2021. So the last day of your PI reporting period must end by October 31st, 2021. So definitely keep that in mind. The same rules apply to the CQM reporting period. In 2020, you could have had any 90-day reporting period during calendar year 2020. However, in 2021, that CQM 90-day reporting period must start and end between January 1st and October 31st, 2021. And the reason for that is because the attestations closed for program year 2021 on October 31st of this year. So make sure you know that deadline and that you are attesting ahead of time to make sure you get all your documentation and that you meet all the requirements for that program year. The other item that changed was the SRA completion date. So for program year 2020, the SRA must be completed on or after the end of the PI reporting period and no later than December 31st, 2020. However, for program year 2021, that did change slightly, and the SRA must be completed within calendar year 2021 and no later than December 31st, 2021. So, for example, if your PI reporting period is starts in July and ends in September, your SRA is allowed to be dated in May 2021. So it can be dated during the reporting period or even before it. So in prior years, so program year 2020, your SRA had to have been dated on or after the end of that PI reporting period, but still within calendar year 2020. That rule no longer applies to program year 2021. So your SRA just must be completed within calendar year 2021. But make sure as you're starting to attest to the program that that SRA is completed by December 31st, 2021. Next slide. So here's a list of the meaningful use requirements, just a general overview. So if any of these requirements trigger a question, definitely make sure to put that in the chat box. So all EPs are required to attest to Stage 3 of meaningful use for program year 2021. All EPs must have a 2015 edition CEHRT implemented. There are 8 objectives, and their related measures must be met. 5 of the objectives are percentage-based measures, and then 3 of the objectives are yes/no measures. If exclusions are selected for any of those objectives or measures, you must meet the exclusion criteria. EPs must also report the minimum required number and types of eCQMs, which is 6 CQMs for program year 2021. The EP must maintain at least 80% of all unique patients in CEHRT, and they must perform at least 50% of all encounters at locations with CEHRT. At the bottom of this slide, there is a presentation for documentation retention. And so throughout this entire open forum today, we do have a lot of presentations referenced that are out there on the Access website that you're able to go in and look at for every single objective and all the different requirements. So there's a lot of information out there. So if you have questions on where to find that, we can definitely show you that at the end of this presentation. Next slide. So here is a list of the Stage 3 objectives. So there's 8 objectives as mentioned previously. The 2 highlighted ones are the ones we're going to focus on today, especially when we start to do polling questions. But keep in mind you can ask questions for any one of these objectives. Objective 1, as you can see, there's an SRA webinar to the far right. So the far right column, resources, has all the webinars that have been put together on behalf of Access and Health Current. And so those are available to you. So if you have additional questions, we can definitely walk through that during this open forum, and they will be out there and available to you even after this presentation. For Objective 2, electronic prescribing, that is a percentage-based measure, and there's also a webinar for that. And moving down, there's clinical decision support, computerized provider order entry, patient electronic access, coordination of care, health information exchange, and then public health reporting, which is Objective 8. So we will be focusing today on Objective 1 and Objective 8. Next slide. So Objective 1, security risk analysis. The objective is to protect electronic protected health information, otherwise called PHI, created or maintained by the CEHRT through the implementation of appropriate technical, administrative, and physical safeguards. There's quite a few requirements that your SRA must meet. And so we do have, of course, presentations out there that list and walk through all of those requirements. If y'all do have any questions about any of the requirements of what goes into that security risk analysis, we can definitely go more in depth on that. So if you do have that question, let us know. And there are no exclusions for this objective. Next slide. So Objective 2, electronic prescribing, we'll briefly go over. The objective is to generate and transmit permissible prescriptions electronically. The measure is that more than 60% of all permissible prescriptions written by the EP are queried for a drug formulary and transmitted electronically using a CEHRT. Next slide. Objective 3 is clinical decision support. It's to implement clinical decision support interventions focused on improving performance on high priority health conditions. This is a yes/no objective, and there are 2 measures underneath this objective. And so an EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions allowed for these 2 measures underneath Objective 3. Next slide. Objective 4, Computerized Provider Order Entry, otherwise referred to as CPOE. The objective is to use CPOE for medication, laboratory, and diagnostic imaging orders directly entered by any licensed healthcare professional, credentialed medical assistant, or a medical staff member credentialed to and performing the equivalent duties of a credentialed medical assistant, who can enter orders into the medical record per state, local, and professional guidelines. There are 3 measures underneath this objective, and it is a percentage-based objective. So each of those 3, they have to meet a minimum threshold to meet each measure, and you must meet all 3 measures to meet this objective. Next slide. Objective 5 is patient electronic access, and so the objective is for the e-PHI provides patients with timely electronic access to their health information and patient-specific education. This objective has 2 measures. They are percentage-based measures, and the EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions for each measure. Next slide. Objective 6 is coordination of care through patient engagement. So the objective is to use CEHRT to engage with patients or their authorized representatives about the patient. And so there are 3 measures underneath this objective, and EP must meet the minimum threshold for 2 of the 3 measures or meet 1 of the 2 available exclusions. The exclusions for all 3 measures are the same. So if the EP meets 1 of the exclusions, the EP can meet the exclusion for all 3 measures. However, if you only meet 1 of the measures' minimum thresholds, you're going to need to either meet another minimum threshold or the exclusion. So keep in mind that you do have to meet a minimum threshold for 2 of the 3 measures. Next slide. Objective 7, health information exchange. So the objective is for the EP to provide a summary of care record when transitioning or referring their patient to another setting of care. Receives or retrieves the summary of care record upon the receipt of a transition or referral or upon the first patient encounter with a new patient, and incorporates the summary of care information from other providers into their electronic health record using the functions of a CEHRT. This is also a percentage-based measure, and it's very similar to Objective 6, and an EP must attest to all 3 measures, but only have to meet the minimum threshold for 2 of the 3 measures. There are also exclusions available for this objective, so there is the possibility of, instead of meeting the minimum threshold, they can meet the exclusion. Next slide. So for Objective 8, Public Health and Clinical Data Registry Reporting, which we will be discussing in further detail during today's webinar, the objective is the EP is to engage, the eligible professional is in active engagement with a public health agency or clinical data registry to submit electronic public health data in a meaningful way using the CEHRT, except where prohibited and in accordance with applicable law and practice. So this is a yes-no objective. There are 5 measures underneath this objective, and EP must satisfy 2 of the 5 measures for this objective. If the EP cannot satisfy at least 2 measures, the EP may still meet the objective if the EP qualifies for exclusions from all 5 measures the EP cannot meet, or from all the measures the EP cannot meet. So for example, if a provider is able to attest to 1 of the measures, but not the other 4, they must meet the exclusion for the remaining 4 measures. Next slide. This is the list of available registries in Arizona. As you can see in the far left column, it numbers each measure, and then the measure name is in the second column. So there is an immunization registry reporting measure, a syndromic surveillance registry measure, electronic case reporting registry measure, a public health registry reporting measure, and then a clinical data registry reporting. So keep in mind, to meet the requirements for this objective, a provider must meet 2 of the measures or the remaining exclusions. So in that third column, available registry number 1, so it kind of identifies the registries that are specific in Arizona to each provider. So as you can see, providers who attest to meet the immunization registry measure need to be submitting data to the Arizona State Immunization Information System, otherwise known as ACIS. And so EPs must be actively engaged to exchange data bidirectionally to meet this measure. So for stage 3, the new requirement for this immunization measure is that EPs must be exchanging data bidirectionally. So make sure your practice is doing that, because the documentation you submit to meet this measure must show that it's being done bidirectionally and that you're not just sending data unidirectionally to the immunization registry. That's the only immunization registry in Arizona. Moving on to the second measure for syndromic surveillance registry, that is not available to EPs. It is only available to hospitals in the state of Arizona. For measure 3, electronic case reporting registry, in the state of Arizona is not available to EPs or EHs, so you would not be able to meet that measure. However, since it's not available to those EPs, you can meet the exclusion for that measure. Same thing goes for measure 2, syndromic surveillance. So keep that in mind. If you do have issues meeting 2 measures, you can potentially take these exclusions, as long as you can take exclusions for the other measures, depending on your situation. So definitely, once I finish explaining all this, feel free to ask questions and even provide a scenario of what your provider might fall into. Moving on to measure 4, public health registry reporting. So in the state of Arizona, there is a cancer registry. However, there are some caveats to that. So available to EPs with the specialties at the very bottom of this slide, the bottom row. So there's only, EPs can submit data if they meet a specific specialty and they diagnose and treat more than 100 cancer cases per year. So to be able to submit data to that cancer registry in Arizona, the provider must first off meet one of those specialties, so a dermatologist, gastroenterologist, hematologist, medical oncologist, radiation oncologist, a surgeon, or urologist. And so they have to meet, first off, that specialty, and then they must treat greater than 100 cases per year. So if you don't meet one of those requirements, that means that you can't submit data to the cancer registry. However, although you're not submitting data, you're not able to submit data to the cancer registry, there are still other public health registries out there that are federally run. And so, as you can see in the far right column of this table, you can research the national public health registries related to your specialty. So depending on what type of provider you have, potentially there are additional registries out there. So to be able to take the exclusion for this measure, you need to show that you went out and looked at the national registries to see if you could submit data there. So definitely go and do your due diligence and make sure you're looking for additional registries, potentially. The same type of reasoning goes to measure 5, which is the clinical data registries. And so there are 2 different links here that take you to a list of CMS-approved clinical data registries that your provider can potentially submit data to. So definitely check out that link, see if your provider can submit data to those registries. Keep in mind that for measures 4 and 5, EPs may choose to report on up to 2 registries and count each registry towards the 2 measures required by the objective. So for example, if your provider is submitting data to the cancer registry and they found another national public health registry, that counts as meeting 2 measures because you're submitting data to 2 different registries. And so then you would not have to submit data to any other registry or meet the other measures underneath this objective. And so that's kind of just an overview of all those 5 different measures. So if you do have any concerns on not meeting the requirements for this objective, definitely feel free to put a question in the chat box and we can discuss a specific situation that your provider might fall into. Next slide. So what is electronic clinical quality measure? We briefly talked about at the very beginning of this being one of the requirements. So we call them CQMs, and they use data electronically extracted from CEHRT and/or health information technology systems to measure the quality of health care provided. The Centers for Medicare and Medicaid Services use CQMs in a variety of quality reporting and value-based purchasing programs. Hospitals, professionals, and clinicians use CQMs to provide feedback on their care systems and to help them identify opportunities for clinical quality improvement. CQMs are also used in reporting to CMS the Joint Commission, and commercial insurance payers in programs that reimburse providers based on quality reporting. Next slide. The definition of CQM for the PI program specifically, so EPs must attest to 6 out of the 47 available CQMs. Out of those 47 available CQMs, 6 of them are outcome measures, 27 are called high priority measures, and 14 are just the remaining regular measures. So there's kind of 3 different priority levels that we look at. And so a provider must try to meet priority level 1 before they move to meeting priority level 2. They can't meet priority level 2, they'll move to trying to meet priority level 3. So the provider, when attesting to those 6 CQMs, need to meet one of these priority levels. So the first and most important level, if relevant to the provider's scope of practice, at least one of the 6 CQMs should be an outcome measure. Now, if there are, and there's only 6 outcome measures, so if a provider's scope of practice does not relate to, any of the 6 outcome measures, they would move to trying to meet priority level 2, which is if no outcome measure is relevant, at least one CQM should be a high priority measure. Now, keep in mind there are 27 high priority measures, and so you would want to try to attest to one of those 27 high priority measures. You can attest to more than one. Just to meet priority level 2, you need to attest to at least one of them. Now, moving to priority level 3, if no outcome or high priority measures are relevant, report on the relevant measures if possible. Of course, no matter what, you must attest to 6 CQMs. Whether they are relevant to your practice or not, you must at the very least attest to 6 out of the 47 available CQMs. Next slide. Now we're going to be moving to just some general polling questions. They're just related overall to the PI program, and this can relate to program year 2020 or program year 2021. So the first question is, has 2015 certified electronic health record technology been fully implemented at the practice? And as Christine mentioned at the beginning of the presentation, at the very top are the instructions. So you can either use the internet on your computer, so respond at pollev.com/EOprogram753 to choose your response, or you can text EOprogram753 to 22333. And then once you join, and you're going to be texting at that point A, B, C, or D. So yes is A, no is B, C is unsure, and D is not applicable. We're going to give you about 15 to 20 seconds to respond, and then we'll discuss the responses from everyone. Okay, we'll give you a few more seconds to put in your responses. And as you can see, everyone said yes. And so if you are attesting to program year 2020 or 2021, your practice needs to implement CEHRT. And so that's great that you've all implemented it. Keep in mind that if you have not implemented it, you need to implement it in order to be able to pull the correct reports and meet all the requirements for the program. And you must implement your CEHRT by the first day of the PI reporting period. And it has to at least be an EHR, and then for it to be certified by the last day of the PI reporting period. So if you have any concerns about whether your electronic health record is certified, definitely reach out to Access, or we can talk through that situation on the call today. Next slide. So the question is, when do attestations for program year 2020 and program year 2021 close? So you're going to do the same responses. Either you can use your internet and go to the website, or you can use your cell phone and text your responses. There are 5 responses. So the question again is, when do attestations for program year 2020 and program year 2021 close? Text A for July 31st, 2021, B for October 31st, 2021, C for December 31st, 2021, D for January 14, 2022, or E for unsure. So when is the last day that you are able to attest for payments for program year 2020 and program year 2021? As y'all probably guessed, they both close on the same day. And so this is when you're attesting for the program, all that has to be entered into e-PHI by this date. and documentation submitted for it to be reviewed. We'll give you about 10 seconds to respond. A few more seconds, and then we'll discuss the responses. Okay, so I see y'all picked the most obvious two choices, October 31st, 2021 and December 31st, 2021. So B is correct. Attestations for program year 2020 and program year 2021 both close on October 31st, 2021. So if you are planning to attest for either one of these programs, you must attest and submit all your information in e-PHI and complete that attestation by October 31st, 2021. Okay? We are not keeping attestations open past that date, so make sure you have attested to everything in e-PHI like you've done for prior years, and you've submitted all data and documents to support your responses by October 31st, 2021. Okay? If you have any questions about that, definitely let us know. Or if you have any concerns, you can feel free to reach out to Access, and we can definitely discuss that with you. Next slide. Then this question is, have you already or do you plan to attest for program year 2020? Give you a few seconds to answer that. A for yes, B for no, C for unsure, or D, not applicable, which means you will not be attesting to the program for those years. And definitely, as you're starting to respond, I see that some of them responded with unsure. And so if you are unsure about that, if it's because potentially your provider's not meeting a requirement, or if you have any concerns about the documentation you're submitting, definitely feel free to, again, reach out to Access and ask those questions. Access wants to help you and assist in any way that they can to help you attest to either one of the program years. Okay, next slide. And then this is asking if you plan to attest for program year 2021. Now, I know program year 2021 is not open yet, so will you be planning to once it is open? A for yes, B for no, C for unsure, or D for not applicable? Give you about 5 to 7 seconds, maybe 10 seconds to answer this question real quick. And these are just to get an idea as we move throughout this presentation and ask you additional questions of whether you want us to focus more on program year 2020, 2021, and what concerns you may have moving forward. Give you a few more seconds to answer. A for yes, B for no, C for unsure, or D, not applicable. Okay. Sounds like everyone's planning to attest for program year 2021, so that is great. Definitely try to submit your attestation and documents as soon as possible so we can start to work with you to make sure those documents are sufficient and that you submitted everything appropriately. Next slide. And so this question is going to allow you to provide any response. So what is your biggest concern attesting to program year 2021? So definitely we're going to have some extra time to answer this question. Feel free to put any responses in there. We can definitely address those during this. So we'll give you all about 20 seconds. What is your biggest concern attesting to program year 2021? Okay, it's definitely, not sure yet. It's definitely most likely a common response with a lot of providers. Definitely since you probably have not started looking at that data. Since Program Year 2020 is currently open, you're probably starting to focus on your documentation for Program Year 2020. And so as you start to end of Program Year 2021, there may be concerns because the timeline has changed. Normally, you would have additional time after the calendar year for that program year to attest. However, because of the CMS guidance and regulations, we have to go through your attestations pretty quickly. And so we just you need to make sure that as you're looking at that documentation and preparing to attest for Program Year 2021, that you're pulling that data, you're making sure your provider meets all the requirements. And as you have concerns or any hesitance on anything that comes to mind when it comes to whether you mean the percentage-based measures or your security risk analysis, definitely use the information out there, the webinars that have been created. We've created frequently asked questions for the different requirements. So definitely go through those as you're having any concerns or hesitating on even attesting to the program. Feel free to reach out to Access and Health Current with any questions you may have for them as we're starting to attest to the program year. Next question. Okay, so what PI program topics would you like to see more of? So as you're starting to attest to the different program years for Program Year 2020 and Program Year 2021, are there any specific topics that come to mind regarding this program that you potentially haven't seen or you're not aware of have been created, that you have maybe have some concerns about, or you can see that that's more of a more trouble as you're attesting to each of the programs? And since this is you can respond with any responses, definitely we'll give you probably about 20, 25 seconds to respond and let us know any topics that you would like to see more of. And it could be that all those program topics are out there and you've seen them on the Access website. I know during the last open forum, we did go over where to find those documents when it comes to the different objectives and everything. So you may have seen those already and know where to go for those topics. So as you do review those presentations and FAQs that have been previously provided to you by Access, definitely consider looking at those. And if you have any questions, reach out to Access. And of course, you can definitely put your responses in the chat if anything comes to you throughout this presentation regarding any future topics you want to see more of. Definitely let us know and put that in the chat box. And we'll move forward to the next question, which is, would you like to be contacted for further assistance? A for yes, B for no, and C for not applicable. We'll give you all a few minutes or a few seconds to respond to this one. So if you do want to be contacted afterwards, if there is a scenario or something you're concerned about for a provider and whether they meet a specific requirement, we can definitely reach out to you afterwards and talk to you about that. I'll give you just a few seconds to respond to this question. Sounds like you're good so far. Again, if y'all have questions, put them in the chat box and we can answer them during this call. Next slide. So now we're going to start to discuss the polling questions for Objective 1, protecting your patient health information, which is your security risk analysis. Next slide. So this is asking, must the program year 2021 SRA be completed on or after the end of the PI reporting period? A for yes, B for no, C for unsure. We'll give you a few seconds to respond. So again, the question is, must the program year 2021 SRA be completed on or after the end of the PI reporting period? A few more seconds to send in your responses, and then we'll talk about the correct response, correct answer. Okay, so we have 33% said yes, and then 67% said unsure. So the correct answer is no. So the trick in this is that it says must the program year 2021 SRA be completed by such and such date. And so for program year 2021, the SRA requirement is that the SRA must be completed within calendar year 2021, so between January 1st and December 31st, 2021. Now that requirement and that timeline is slightly different from program year 2020, where this requirement did take into effect, where the SRA for program year 2020 had to have been completed on or after the end of the PI reporting period, but within the calendar year for that program. Moving on to the next slide. This question is, what is the last date the SRA must be completed for program year 2021? A is October 31st, 2021, B, December 31st, 2021, C, January 14th, 2022, or D, unsure. Again, this is asking what is the last date the SRA must be completed for program year 2021. Give you a few seconds to respond to this question. Again, as y'all are responding to these questions, definitely feel free to ask any questions that you may have, even if it does not relate to security risk analysis. We definitely want to answer all your questions during this open forum. Okay, hopefully you got all your responses in. So what is the last date the SRA must be completed for program year 2021? The correct answer is B, December 31st, 2021. So the SRA must be completed and dated by December 31st, 2021. Now, the January 14th date comes in and trips you up because January 14th, 2022 is the date you must submit your SRA to Access. However, between January 1st, 2022 and January 14th, 2022, the practice is not supposed to be able to update or change their SRA or date their SRA at that point. Everything for the SRA must have been completed by December 31st, 2021. Even though you don't submit to Access, the only appropriate and accepted dates when reviewing your security risk analysis that will be accepted by Access is when your SRA is dated between January 1st and December 31st, 2021. So make sure you complete your SRAs and put everything in that document by December 31st, 2021. Next slide. This is asking what is the last date the EP must submit the SRA to Access for program year 2021? A, October 31st, 2021, B, December 31st, 2021, C, January 14th, 2022, or D, unsure. And we'll give you just a couple seconds to answer this question. I did give the answer out during the last question, so everyone is correct. The last date the EP must submit the SRA or is allowed to submit the SRA to Access for program year 2021 is January 14th, 2022. So make sure when you come back from the holidays and everything that you have a plan in place to submit that SRA by January 14th. It is recommended, of course, that you submit your SRA as soon as possible. So if your security risk analysis is completed December 1st, 2021, definitely feel free to go ahead and submit that to Access. And so if they have any questions, they can follow up and ask you those questions. Keep in mind that I did mention to y'all that program year 2020 and program year 2021 closes on October 31st, 2021. Your SRA for program year 2020 must be submitted by the end of that attestation date, so by October 31st, 2021 when attestations close. The only caveat is program year 2021 when it comes to submitting your security risk analysis. Access is allowing additional time to practices who may create or may finish their SRAs at the end of December so they can submit it after that October 31st close of attestation. But program year 2020 SRAs need to be submitted by October 31st, 2021. The only exception is program year 2021 SRAs, and that is that they must be submitted to Access by January 14th, 2022. Next slide. So what will happen if EP does not submit the SRA by January 14th, 2022? You can respond A, nothing, B, automatic rejection for payment or full recoupment, or C, unsure. The question is, what will happen if the EP does not submit the SRA by January 14th, 2022? A, nothing, B, automatic rejection for payment or full recoupment, or C, unsure. Give you a few seconds to respond to this question. And make sure to get your responses in. The correct answer is B, automatic rejection for payment or full recoupment. So if the provider has already been paid by December 31st, 2021, and that SRA is not submitted by January 14th, 2022, then there will be an automatic full recoupment of that payment if the provider was already paid. If they were not already paid, then after January 14th, 2022, if no SRA is submitted, then there would be an automatic rejection for payment. Next slide. And it looks like we're just having a...
Sorry, Priscilla, bear with me. For some reason, it disappeared. So I apologize.
No worries. Let me know if your internet
Hang on,
connection is
it's
not
asking me to, for some reason, it's asking me to restart the PowerPoint. I'm not sure why, but and I apologize, but let me do that again. It's strange.
And so definitely be, as we're pulling the presentation back up, definitely be thinking about your security risk analysis. And if you're not aware when your practice is completing your security risk analysis, keep in mind that you need to be reaching out to the to whoever's in charge of that security risk analysis and ask them when they're completing it, because if they're doing a review of it or anything towards the very end of December, that quick turnaround to get it into your hands, to get it to access hands, may be difficult coming back from the holidays and everything. So make sure you have a plan in place as you are moving forward and attesting to these programs, to program year 2021, to make sure you're able to submit that SRA on time, because it's very important that you submit it on time. Okay? And our next question, which we're about to pull up, it's going to be on slide 31.
Okay. Yeah, I'm not sure why it stopped. Excuse me.
It was a sign I needed to explain for the plan to be put in place to make sure you know when that security risk analysis is being created. Thanks for bringing that back up, Christine.
Sure. Sorry about that.
No worries. So this next question is, when does your practice plan on completing your program year 2021 SRA? So definitely if you know that answer, put that in there. If you're unsure, just respond with you're unsure about that, because that means that you know that you need to reach out to the practice, whoever's in charge of the security risk analysis, to find out when they're finishing it, so that you know when to submit it to access. So just because the October 31st deadline, you submit all the documents except for the SRA, you may move forward thinking, oh, I'll think of it later down the road. But you must submit that SRA by January 14th, 2022. So definitely make sure you have a plan in place for when you're going to submit that to access. And to be able to put that plan in place, you're going to need to know when your security officer is finishing that security risk analysis. Okay, looks like most people are unsure about when they will be submitting it. So again, make sure to reach out to your security officer or whoever is in charge of the security risk analysis and ask them when they're going to complete that. Next slide. So if your practice recently started using telemedicine, did the practice update their SRA to include telemedicine being incorporated at the practice? And so this is asking, so a lot of people during COVID-19 had to start using telemedicine and just move a lot of things electronically. And so if you started doing that, did you include that information in your SRA? And so A for yes, B for no, C for unsure, or D not applicable. We'll give you a few seconds to respond to that. And you definitely may not know about that. So definitely just be considering that. That's just something to think about. because you want to make sure the security risk analysis covers your entire practice. Any place that may contain patient health information or any place where your employees work or handle any paperwork, you want to make sure is covered underneath your security risk analysis. So make sure you're aware of that and it's being included in your security risk analysis. I'll give you a few more seconds to respond. And in the past, during we've created a presentation solely for security risk analysis. And in that presentation, it does discuss the periodic reviews of your SRA. So every year you have to update your SRA and make sure your SRA for this program is in line and it is covering the entire scope of your PI reporting period, and that's covering all the patient health information at your practice. And so it does walk through examples of when you may need to create an entirely new SRA versus just updating your SRA. So if a practice, for example, did not use telemedicine prior to program year 2020, and then they started using that, they may need to do a whole new SRA depending on how significantly using telemedicine affected their practice, or they may need to just add a section to that security risk analysis and say, hey, here's what we're doing for telemedicine, here's how we're covering it, here's how we're protecting the patient health information that's being used while using telemedicine services. So there's really not a wrong or right answer to this because it's really up to the practice to make sure you're covering the entire scope. If we see something in that SRA as we're reviewing it that you left something out that we know you left out, so you're not meeting one of the requirements such as addressing encryption of patient health information at your practice, then there may be some concern. And so just definitely make sure you're paying attention to the people who are creating the SRA if you're not creating it yourself. And make sure that you're implementing and making sure that security risk analysis is complete and includes all the requirements underneath Objective 1. Next slide. Now we're going to move to polling questions for Objective 8, Public Health and Clinical Data Registry Reporting. As we start to move through these polling questions, I know we have about 10 minutes left of this presentation, so definitely feel free to put any questions you have in the chat box, or we can even unmute you to answer any additional questions that you have about any of the requirements of this program. So next slide. So this question is asking how many of the possible 5 measures under Public Health and Clinical Data Registry Reporting, Objective 8, must an EP meet? So how many of those 5 measures? A for 1 measure, B for 2 measures, C for 3 measures, D for all 5 measures, or E for unsure. Give you a few seconds to respond. And you are correct. So it is B, 2 measures. So out of the 5 measures, a provider only has to meet 2 of the measures for submitting data to the registry. Unless, of course, they're claiming exclusions, and then they may have to meet exclusions for all the remaining measures that they did not meet and submit data to a registry for. Next slide. And so this next question is, which measures below is the EP using to meet the requirement for the Public Health and Clinical Data Registry Reporting objective? So which measures are you going to use to meet the requirements for Objective 8? And so you can select multiple answers. So you just text A, B, like you text both of those letters. So A for measure 1, B for measure 2, C for measure 3, D for measure 4, and E for measure 5. And to keep in mind that you do need to select 2 measures to meet the requirements. And so you can definitely send 2 different text messages to pick each one that you're meeting. And so this just gets you thinking, there's no like right or wrong answer for which measures you're going to be meeting, but it just gets you thinking what measures can your provider submit data to, and you need to start making sure that they are in that production phase that they need to be in, whether that's registration, testing, or actively submitting data to those registries. And so you need to make sure you have those registries, and if you can't submit data to registries, then you need to be able to make sure that you know the reason why and that it falls underneath one of the exclusions. Next slide. does the EP meet the Public Health and Clinical Data Registry Reporting Objective 8 requirements if, and this is a scenario, if the EP meets Measure 1, immunization registry, and an exclusion for Measure 2, syndromic surveillance? Respond A for yes, B for no, C for unsure, or D for not applicable. So there's a provider, they're submitting data actively to Measure 1, immunization registry, but they're claiming the exclusion for Measure 2. Do they meet the requirements for this objective? A for yes, B for no, C for unsure, or D for not applicable? Give you a few seconds to respond. Okay, so no is the correct response because they're actively submitting data to one registry, but they're taking the exclusion for Measure 2. And since they're taking that exclusion, that means they need to meet the exclusions for all the other measures or be in active engagement with 2 different registries, okay, which fall underneath one of those 5 measures. So keep in mind that just because you're taking an exclusion for a measure does not mean you're in active engagement with a measure. You must be in active engagement with 2 different registries that fall underneath one of those 5 measures. Next slide. For the immunization registry reporting measure, is the EP submitting immunization data bidirectionally? So currently for your provider, are you submitting immunization data bidirectionally to the immunization registry? A for yes, B for no, C for unsure, or D for not applicable? Give you just a few seconds. Okay, the correct answer should be yes if you're using the immunization registry as one of your measures for program year 2021. So if you're going into testing a program year 2021 and claiming to be in active engagement with the immunization registry, you need to make sure your provider is submitting data bidirectionally. If your provider is only just submitting data unidirectionally to the immunization registry, you're not able to claim that measure for program year 2021. And if you have more questions about how to switch from submitting data unidirectionally to bidirectionally with the immunization registry, definitely put that in the chat box and we can discuss in further detail about that. Next slide. The next question is for an EP who is submitting data to the immunization registry, does the EP need to reach out to the Arizona State Immunization Information System to start submitting data bidirectionally? And that kind of is going to answer our question. Respond A for yes, B for no, C for unsure, or D for not applicable. So if you're unidirectionally submitting data to that immunization registry, do you need to reach out to ACES to start submitting data bidirectionally? Give you just a few seconds to respond. A for yes, B for no, C for unsure, D not applicable. And it looks like 100% of you are correct. To be able to switch from unidirectionally submitting data to bidirectionally, you need to reach out to ACES, and there is certain contacts that you can reach out to there and to request that, and they can give you more information on that. If you have any concerns or issues contacting them, definitely let Access know, and we can help you out and direct you to the right person. Next slide. And this is our last question for today. It says, can EP meet the exclusion for the Public Health Registry reporting, Objective 8, Measure 4, if the EP does not see any cancer patients in the state of Arizona? Give you just 5 seconds to answer that. A for yes, B for no, C for unsure, or D not applicable. We do have a couple of minutes left of the presentation, or before the webinar ends, so definitely if you have any questions, feel free to request to be unmuted in the chat box or put in any questions that you have. And 100% of you are correct, it is no. So an EP cannot submit data to the cancer registry if they're not seeing any cancer patients in the state of Arizona. Next slide. And then next slide, we're going to be going over a few resources that just will be coming up over the next few months. So there's future webinars for more open forums that will focus and kind of have questions to get you thinking about the other objectives. So our next webinar will be June 24th next month, and so these are the links that you can click on to register for each of these future webinars. Next slide. And as we end this presentation, we'll leave this contact information slide up. So if you have questions about public health registries or any questions for Access or Health Current, there's a list of emails as well as phone numbers for how to reach them for any additional questions you have that may come up after we end this webinar. Again, feel free to put any questions you have in the chat box or unmute yourself, and we can talk through any questions you have.
Thank you so much, Priscilla. Again, the chat box is open if you have questions for Priscilla or if you'd like to come off mute. I'm happy to unmute anyone's lines and you can ask your question live. Question came through about, yes, we will be sharing the slide deck following today's presentation. It also was recorded and will be posted up on the Health Current and Access websites. This was some great dialogue. Priscilla, thank you so much for sharing all of this information. The polling I thought was very interactive. So I really appreciate everyone's participation in that today. We'll hold for just another few moments to see if any additional questions come through the chat box. Priscilla, I know we're right at the top of the hour. Did you also want to share any of those tip sheets that we'll also include with the email that will follow?
So all of those tip sheets are on the Access website, and there are some links throughout this webinar that reference and would take you straight to the Access website. And yeah, feel free to share them on your screen. These are just a few of the frequently asked questions and tip sheets that are out there that Access and Health Current have worked together to present to you. So if you do have questions about the SRA, public health, or any other requirements, there's a lot of resources out there. So definitely feel free to go to the Access website. So there's a lot of links throughout the presentation today that will take you there, and you'll be able to see the various resources, FAQs, tip sheets that will help you, and even presentations for all the different objectives. So definitely there's a lot of resources out there. If you can't find them, feel free to reach out to Health Current or Access, and they can definitely assist you with where to go and point you in the right direction.
Wonderful. That is fantastic. And these will also be included as well with today's presentation. And there are live links in these documents with the FAQs, with the tips within the webinar itself. Great information. And the last FAQ is right here.
And this FAQ that she's going over right now is specifically for Objective 8 Public Health. So all the questions throughout there are specifically related to that objective if you have questions about public health.
Wonderful. Well, with that, it also looks like somebody has put a link to educational resources in the chat as well. So that is also available. And I know we are just past our time today. So again, I will thank everyone for joining us for today's presentation. Let me pop back right here to the contact information. Is all available here, both for email and telephone. Thank you again, Priscilla, for sharing the information for the program year 2021 Objective 1, protective patient health information, the security risk analysis, and Objective 8, public health and clinical data registry reporting for the Medicaid Promoting Interoperability PI program. I appreciate again everybody's time today, and that will conclude today's webinar. Thank you.